I think the most important is awareness of disease. Because if you don't find the diagnosis of painful bladder syndrome very early, there's a high chance that this diagnosis is delayed and the results of any treatment will be worse. So the doctors and the patients too, they have to be aware that painful bladder syndrome is a disease that can be treated today. The diagnosis is very easy. If you have pain in the bladder region, if you have voiding symptoms, and if you don't find any other cause, especially infection for these symptoms, it's very likely that the patient suffers from painful bladder syndrome. The next step that we do is we do potassium testing. That is a test that shows that there is if the barrier between urine and tissue is normal or if there is a disorder. And patients who show a disorder at the urine tissue barrier in the sense of a positive potassium test, they are ideal candidates for hyaluronan intravesical therapy. What we do instillation of this substance weekly for at least 10 times. Normally the treatment times are about 3 months, and we have shown in a study with more than 120 patients that the chance of remission is more than 80% in this group of patients. I would say it is similar to a lot of things that you can buy. They may be more expensive in the beginning, but in the long run they may turn out to be rather cheap. We have made a study that will be published this year that compares hyaluronan instillation therapy to other therapies for painful bladder syndrome. The big difference is that, as we have shown, that you are able to cure about 50% of the patients that you treat with hyaluronan, and that is never been reported by any other treatment for bladder pain syndrome. So if you can cure 50% of the patients, the long-term costs are much lower for hyaluronan treatment than for any other therapy that runs through the whole life. We're expecting publication in the second half of this year, and this has been a study for the Austrian environment, but it can be done for every country. It is a modular system how you can calculate the treatment costs for every country, and it will show that just by giving cure to a considerable part of the patients, you don't have the most expensive treatment but a cheap kind of therapy.